Holistic nursing is the approach of incorporating mind, body, spirit, emotion, and environment with the traditional practices of nursing. The main goal and focus of this approach is to heal the patient as a whole, including not only the physical aspects of healthcare, but hitting hard on the deeper emotional and spiritual level. It is not just merely something we do, but rather an attitude, a philosophy, and a way of being that requires nurses to integrate self-care, self-responsibility, spirituality, and reflection in their lives.
Holistic nurses nurture wholeness, peace, and healing by valuing each person's physical, mental, emotional, spiritual, and environmental strengths and challenges and honoring each person's values, health beliefs, and health experience. The condition of the whole person is taken into account during the nurse's assessment, diagnosis, planning, intervention, and evaluation of the results. Holistic nurses, often called complementary health nurses, can work in all health fields. Holistic nurses help individuals and groups assess their greatest healing potential across mainstream and complementary systems.
Holistic nurses often employ alternative forms of medicine alongside traditional Western medicine in the practice. This may include dietary advice, acupuncture, therapeutic massage, and meditation therapy. Those practicing holistic nursing will often encourage patients to integrate self-care, self-responsibility, spirituality, and reflection into their lives as to help maintain a proper balance of mind, body, and spirit.
Present-day holistic nursing is based on the work of Florence Nightingale, who is actually considered to be the founder of holistic nursing. She taught nurses to focus on the principles of holism. These principles are unity, wellness, and the interrelationship of human beings and their environment.
As of 2006, the American Nursing Association officially recognizes holistic nursing as a specialty area of nursing practice. Before this, there was the American Holistic Nurses Association, that was founded in 1980 to serve as a voice for holistic nurses. Later came the American Holistic Nurses Certification Corporation, that was founded in 1997 to credential holistic nurses and advance the education and role of holistic nurses. Coming a long way from that first organization was 40 years ago, the concept of holistic nursing has established a strong foundation and recognition in the nursing community.
To become a holistic nurse, RNs can apply for certification through the American Holistic Nurses Certification Corporation. To be eligible for certification, RNs are required to show proof of continuing education in holistic nursing and must complete and pass both a qualitative assessment and quantitative exam to earn certification.
Holistic nursing is based upon a unique body of knowledge, evidence-based research, sophisticated skills, defined standards of practice, a diversity of modalities from a broad range of health practices, and a philosophy of living and being that is rooted in caring, relationship, and interconnectedness.
Holistic philosophy, theories, and ethics emphasizes that holistic nursing is based on a philosophical framework embracing holism and a commitment to education, reflection, and knowledge. The holistic caring process emphasizes an evolution of the nursing process to embrace assessment and therapeutic care addressing client patterns, problems, and needs in an atmosphere of caring. The holistic communication, therapeutic environment, and cultural diversity emphasizes the requirement for nurses to engage with clients to promote mutually determined goals for health and healing. The holistic education and research emphasizes that professional nursing is grounded in theory, informed by research, and bound by ethical principles to guide practice that is competent, thoughtful, and principled. Holistic self-care is based on the belief that nurses must engage in self-care to promote health and personal awareness so that the nurse may serve others as an instrument of healing. These 5 core values integrate the art and science of nursing to capture the true essence of holistic nursing as a specialty. Specialty status provides both nurses and the public health with greater clarity, sets a foundation for holistic practice, and strengthens the voice of the entire profession.
As a nurse, we can not only use holistic care to enrich the lives of our patients, but to enrich our lives as well. Nursing is a tough profession. It is physically, mentally, and emotionally draining at times. Other times you can experience a patient or a moment that reminds you why you became a nurse. One way to increase these experiences and provide better overall care to our patients is through holistic nursing care. The key is not necessarily about how long you spent interacting with that patient, but how you use that time you had with them.
Holism is more than certain actions performed or words spoken to a patient. Holistic care is a philosophy. It's a method to ensure care for all parts of a patient while maintaining a sense of relationship.
There are many easy ways to improve relationships with a patient and promote a healthy psychological, emotional, and spiritual environment. Some of these ways are to learn the patient's name and use it, make good, strong eye contact, ask how a patient is feeling and sincerely care, smile and laugh when appropriate, use therapeutic touch, assist the patient to see themselves as someone who deserves dignity while also preserving that dignity. Educate your patient on the importance of self-care, ask them how you can reduce their anxiety or pain. Use non-pharmacological methods of pain control such as imagery, relaxation techniques, and more. Encourage the patient and assist them as needed with alternative treatment. This could be massage, aromatherapy, or even music. Ask the patient if they have any certain religious, cultural, or spiritual beliefs. Be sensitive and accepting if they do.
This is a small list of changes that can be implemented in order to focus more on holistic care of your patients. At the end of the day, holistic care is not even about how many holistic actions you performed. What matters is having the intention to care for each patient as a whole and being present for that patient while you can.
A situational example of holistic nursing can be providing a 16-year-old female patient who has recently been diagnosed with leukemia with the de-stressing activities of a back massage and accompanying manicure and pedicure. It is in this situation that you take on the role of a companion, working to relieve the stress and worry that the patient may be experiencing. While the patient can be prescribed medication for the pain and treatment, this does not treat all her complications, mental health being the biggest one. These acts of therapeutic touch can provide a sense of ease and allow the physical healing to take place and provide a full body healing for this patient. Stress and pain hinders the process of healing and can actually be detrimental to her overall health and treatment. Being understanding of her situation and showing empathy for it while also supporting her can treat her mental and spiritual health seen through the course of her treatment with leukemia.
Another example of holistic nursing care provided for a patient can be the establishment of a dietary plan for someone who has recently been informed of an unmanaged diagnosis of diabetes. She can provide him with meal plans, supplements, and alternatives for foods he may have been accustomed to, while also introducing him to a more plant-based, lean protein, and healthy fat diet. Aside from the dietary aid, the nurse can help him come to an acceptance of his new reality through education and guidance. It is important to get to know the patient, whether that may be their family makeup, background, fears, or just their personality. This will help guide what kind of plan you should provide them, knowing what they have access to, their financial stability, or if they have means of going to retrieve these items. The nurse could follow through with his new health diagnosis and determine if these provided life changes are suited for him or if they need some adjustments to fit his individualized health plans.
Unfortunately, there is compelling evidence that most nurses have been educated with a biomedical allopathic focus and do not have a good understanding of the meaning of holistic care. In this regard, patients' other needs and sometimes more serious problems are not addressed as the mental, spiritual, and social needs of patients are neglected, and patients are considered as biological machines.
Using the ordinary medical model alone for treatment exposes patients to serious threats, prolongs hospitalization, and raises treatment costs. In many countries such as the UK, Australia, and Iran, holistic aspects of patients' needs are often overlooked. Similar studies conducted in the USA have revealed that 67% of American patients in hospitals do not receive holistic care.
The individualized care allows the patient to heal by changing their lifestyle choices and applying their beliefs to their treatment. Nurses are fully aware of the patient's struggles and strengths, which can be used to help the patient cope, adapt, and recover. The combination of holistic nursing and contemporary Western medicine expands the nurse's ability to offer the best treatment options for each patient that they may have.
Improving the sense of mental health goes a long way in the full body healing of a patient. When this component is not touched on, we deprive a patient of the basic right of feeling comfortable and safe. We will now present a video that presents Congressman Patrick Kennedy, author and chief sponsor of the Mental Health and Addiction Equity Act. He will touch on the bigger idea of how holistic care impacts the overall well-being of the patient.
As a member of Congress, I had the honor of writing the Mental Health Parity and Addiction Equity Act, which requires insurance companies to provide coverage for mental illnesses and addictions in the same way they would medical and surgical care. So it's basically saying the brain is part of the body. But we know that these illnesses are threefold, at least for those of us who are suffering from addiction. We know it's body, mind, and spirit. So in order to properly allow people to live in recovery, you've got to first detox them if they're addicted, but you then need to provide kind of the mental health care and the spiritual support, because this has to be a comprehensive solution. What's been missing in the past in our whole approach is the comprehensive nature of this disease being kind of taken care of holistically. And so I think the church provides a very important component to helping to ensure that the person has long-term recovery options. We're at an inflection point in our healthcare system today. We know we need to be about healthcare, not sick care. And the key to this is providing people the support systems for them body, mind, and spirit. We're about trying to do that for the body with healthcare reform that focuses on chronic care management, coverage of the illnesses of mental health and addiction. But in order to have people with those illnesses have a chance for long-term recovery, they need to have the spiritual element of this embraced by both the medical system, and we need the medical system to understand and embrace the powerful component of having the church and a spiritual life become a part of this solution. So for both of us, we need to all work together, because we're talking about whole care and the whole person. That's who our objective is to take care of that person holistically. So it means that all of us have to give up our silos and figure out how it is that we can ultimately work together, because our objective is to help that person suffering. And you cannot do that if you only provide support for one component of their recovery. You have to provide support for all components of their recovery. On my father's Mass card when he died was the Matthew 25. Who's ever there for the least one of these, my brothers and sisters, is there for me. That is our guiding light in terms of ensuring that those who are treated as the least one of these, my brothers and sisters, is actually welcomed and embraced and loved. And that has to be our guiding principle. And I so appreciate what Rick and Kay are doing in this space.
Some review points from Dr. Kennedy is that the brain is a part of the body, linking back to a piece of the body, mind, and spirit that holistic nursing is often referred to. Another is that comprehensive nature for this approach allows for long-term recovery, with the spiritual factor being a powerful component. Healthcare is above sick care, seeing that the patient is not just their illness. And lastly, provide healing for all aspects of recovery, treating each patient as if they were your brother or sister.
The overall takeaway factors from holistic nursing is that holistic nursing should not be undervalued for its effect on patient care, as it can greatly impact the overall healing process. This specialty should be adopted by all nurses, as they should not just focus on the physical care, but also the spiritual healing and love that they can provide. Without the mental and spiritual healing, the physical recovery can be hindered, and in more serious cases not even occur due to the heavy weight a patient may have on their mind. As a nurse, we should always see the patient for more than just a diagnosis. We should see them in their complete image of mind, body, and soul.